Okay, I'm calling this our HRT 101 today with Dr. Cate because I did a Instagram reel, Facebook reel the other day, putting on my HRT, and the amount of feedback, comments, questions I had, I messaged Kate straight away and I'm like, Kate, SOS, we need to do more information. so, so we have got the fabulous Dr. Cate Bendel here today, and she is going to run us through some of this. So we put out more information, education to help people understand this process. Kate, kick it off.
Amazing. So I was really interested that everybody had commented on your application and wanted more information. And I think it's something that's really, really important. And I think we'll just go through each option sort of step by step. And then, you can ask questions or, whatever, or maybe fire some of those questions that came up in your little chat. So I'm going to talk about estrogel first. Now, estrogel is the same gel that you used in the video, which
Yes,
is
that's what I
very, very
use.
commonly used for HRT. It's readily available. There's no sort of supply issues or anything like that. So a really good choice for busy ladies because you're not going to spend an hour every month trying to locate it. It is readily available. So it comes in this nice little pump pack. I'm using a placebo because I've already dosed today, so we don't need to overdose. So I'm just going to show you, and I did not wear the right shirt today because I'm going to show you what it looks like on my arm. We're going to use 2 pumps. Now, 2 pumps is probably the average dose that we use for a menopausal lady. We can use 1 pump and we can go up to 4 pumps, obviously under medical supervision. You don't just change your pumps if you want to, but
Mm-hmm,
there's plenty of time and space for you to change your dosage if you need to.
mm-hmm.
So I would suggest you put 1 pump on your lower arm, 1 pump on your upper arm, just to kind of spread them out. Make sure you're fully depressing the pump because they are a metered dose. When you get towards the end of the pump pack, it sort of takes a while to creep back up. That's when you know it's just about at time to replace it. Now, what I would do then with my pumps on my arm is I would actually use the wrist of my opposite hand to
Ah,
spread it like you're buttering toast. So you're actually just spreading that gel nice and thin. You're not rubbing it in, you're spreading it nice and thinly, anywhere from your shoulder to your wrist. So you can actually use the whole side of that arm, front and back, and you can actually apply it from your shoulder to your wrist. Now, the reason I use the wrist of my opposite hand is because now I'm not going to wash my hands and lose half my dose. So I'm
uh-huh.
actually going to get a little bit of absorption here, but the full absorption is actually on that arm. So now that it's on and it's a little bit tacky still, just be mindful because you can microdose your partner or a child.
Mm-hmm.
So really while it's wet, you just need to keep your arms to yourself. Only takes about 3 minutes for it to dry. So you can use it morning or night, whatever fits with your routine best.
Mm-hmm.
Okay. So, I get up at 5:30 in the morning, but for some reason I'm always running late. So I do this at night. The idea of
Yes,
fitting something in that's going to take another 3 minutes is a bit too much for me.
yeah,
Um, so you just wait till it's dry. Once it's dry, you can get dressed, get on with your day. You can go to bed, get on with your day, but just make sure it's dry because otherwise you're going to lose some of that dose onto your bedclothes or your clothing.
mm-hmm.
Once it's been on for an hour, you can go for a swim, you can have another shower, you can do whatever you want, but it really needs a good hour to fully absorb. Now, that doesn't mean you can't touch someone for an hour. As long as it's touch dry, you're totally fine. But yeah, it needs that full hour to totally absorb into your
Gotcha,
system.
gotcha.
Yeah.
Okay,
Yeah.
and that's cool. And then you were mentioning there's another type of gel that people get mixed up with.
Yeah. So there's a second type of gel which has been used pretty commonly. because it was on the PBS before the estrogel was, so it was a good choice for people who were looking for a PBS style medication. The other reason I quite like this is because it comes in little sachets. So every sachet is a dose. So if you're somebody who goes to the gym on the way to work, you can just throw, 5 sachets in your gym bag, and you're not going to leave this on the bathroom shelf in the gym, which would be what I would do. So,
Yes.
so quite handy to have individual sachets because you're not going to lose the whole thing. Again, I've got placebos because that's who I am.
Yeah, this is why we're talking to you.
I know. It goes on a different location.
Oh,
So sometimes I think when people get confused about their gels, they perhaps talk to a girlfriend who may or may not be using the same type of gel. So this is 100% arms.
oh,
So arm is
really?
the best place to deliver
Oh, so
this.
nowhere else.
Not really. It's not been tested anywhere else. So we
Ah,
don't know the effect of it we don't know the absorption effect of it in different locations.
ah, interesting.
So from a medical point of view, we would say arms for this
Right,
guy.
right.
This one's a little bit different. So you know how we sort of had all of that area, we had sort of wrist, shoulder we could use. This can only go across 2 palm widths.
Oh,
Okay, so it's a little bit different. Also, it likes, step back, step back. So it likes inner thigh, so 2
ah,
palm widths inner thigh,
right.
or 2 palm widths lower abdomen.
Ah,
So you've got this much space to get it on your lower abdomen, and same on your thigh. You're not
okay,
spreading it across a really big area, it's a
okay,
smaller area.
right.
So I guess the difference is that this one can stay tacky for a little bit longer because it's not quite as thin. It's a bit of a thicker layer that goes on.
Gotcha.
So it takes a
Okay,
bit longer to dry.
right. And same once a day?
Once a day, morning or
Yes,
night, doesn't
yes.
matter, whatever fits with your routine best.
Perfect. Now, our next option is the patch.
Patch.
Is that
Yep.
right? So
Yep.
we've really got our choices with estrogen is the patch and the gel. Is that correct?
Correct.
Yes.
Correct. For transdermal estrogen.
Yes.
There are some tablets
Yes.
which are fine for some people, not everybody.
Yes. Generally, though, you would recommend the patch or the gel.
Yeah.
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 So there are different types of patches. There's single patches and there is combined patches. I'm just trying to find. I should probably pull these out before I chatted to you.
That's all right.
This little beauty is not actually available in Australia at the moment. It's called an Estradot, but you
That's
can
a
see
little
how
one.
tiny it is.
Yeah.
I know, it's so cool.
Yeah.
It's estrogen only patch.
Oh,
The supply update is that it'll be December this year, so don't get excited about it. It's not available.
heck.
But that size, and this one you can see the indent
Quite a big
patch on
difference in
there.
size.
So the size comparison, and this one's not a bad size. This is just teeny tiny. This one's actually a combined patch, so it actually has the estrogen and progesterone in it, which is
Oh.
quite nice for some people.
Oh.
And why I would recommend this is maybe for those people who are a bit inconsistent with the application, maybe just haven't quite got a routine that works for them.
Mm-hmm.
This stays on for 3.5 days.
Mm-hmm.
So you might put it on a Sunday morning, take it off on a Wednesday afternoon, and then put a fresh one on.
Mm-hmm.
So this again is under your belly button,
Mm-hmm.
above your pubic bone,
Mm-hmm.
in a 360-degree kind of rotation. So
Gotcha.
I would put one maybe here,
Mm-hmm.
and then on the Wednesday night take it off there and put it somewhere completely different.
Gotcha.
So the reason we're moving it around is that we are avoiding getting skin irritation by using the same spot all the time.
Gotcha.
So people who are prone to dermatitis or can't manage Band-Aids, things like that,
Mm-hmm.
obviously that's not really an option for them.
And when you are talking to women, is there a reason why? Is it more lifestyle choice that you would give one over the
Yeah,
other?
there's some sort of specific triggers that really kind of help us to make a decision. And I think one of the things is if sleep is particularly bad,
Hmm.
then we would probably go for something with that micronized progesterone before bed.
Okay.
Okay, just to give you that extra kicker before you go to bed to
Hmm.
make that sleep a little bit more consistent.
And is that in the
So,
patch?
no, that's the tablet.
Oh,
That's your
yeah.
micronized progesterone.
But what I
So,
mean is, like, what would make you choose, like, the gel or the patch? Like, if I was coming into you and I'm like,
yep,
right, we're doing HRT, is it lifestyle choices that you would go patch over gel, or is it just the person makes their own choice, or how do you get to that point?
yeah. So a couple of different things. Obviously, if they've got skin irritation,
Yes,
dermatitis, that's
yes,
out.
yes.
I've never found anyone, even people with very bad eczema, have never
Mm.
had a problem with the gel.
Mm-hmm.
Um, the other thing is that this doesn't give you a kick of progesterone before you go to bed. It's just a steady, even dose all the time. So if sleep is bad, I'd
Mm.
probably opt for the progesterone tablet, the micronized progesterone before bed,
Mm-hmm.
just to give you that extra kicker and keep you asleep,
Okay,
essentially.
okay.
Um, some people, sort of would rather just do something twice a week.
Mm-hmm.
Some people would rather do something every day. It just
Mm-hmm.
depends on their routine, I guess.
Okay.
And
So
so
that's,
it does come down to individualized choice
yeah,
mostly.
yeah, more of a personal lifestyle kind of situation. Yeah, okay.
Yeah,
Interesting.
correct.
Because I think the more we talk about this, then I know people will be listening to this that either haven't tried HRT before, so then we're just giving them the most amount of information, or maybe they're actually on something and they're like, I don't even know what the options are. Like, because that's what's
Yeah,
happening as well sometimes, where you
yeah,
actually go
yeah.
into the GP and you're not getting the information, all the information, and so you don't actually even realize that there's other options. So I know that we're going to hit a lot of different kind of people, so that's
Yeah,
why the most amount of information that I'm asking you all of these questions. So then of
yeah.
course we've got the progesterone as well, that only comes in the
Only
tablet.
comes in a tablet form.
Yes,
Yeah.
yes. And
And
at night.
at night, definitely. Don't take it in the morning. It will make you feel foggier and you might need to have a little nap around 11.
Okay, we won't be doing that. We don't need to be napping in the day. We're very busy women. And
Yes.
then testosterone. Talk to
Yes.
us about testosterone. I heard you mention
Yeah.
it just before.
Yeah. So, testosterone in Australia, we're very lucky. We actually have commercially available a female formulated testosterone. It's called Androfem. It's still what we call an S4 medication. So, it still has the same rules around testosterone. So, we've got to put like repeat interval on it and all those sort of crazy things. Um, I find it probably more useful in menopause rather than perimenopause, but I'm very happy for my perimenopausal women to try it and see
Mm-hmm,
if it helps them.
mm-hmm.
Um, it's a lot more of a slow burn. I think you'll find most people who start, the patches or the gels or the tablets feel better fairly quickly. Like,
Mm-hmm.
3 or 4 days, you're like, oh my
Mm-hmm.
goodness, I'm feeling like a
Yes,
normal human being again.
yes,
It's
yes.
like this real complete shift.
Mm-hmm.
The testosterone is a much more slow burn situation. So it takes 8 to 12 weeks for you to
Right.
really notice much of a difference.
Okay.
So if you are trialing it, you really have to commit to trialing it for a good sort of 3 months for us to
Yes,
go, yes, it's useful, no, it's not useful.
yes.
Um, it is in Australia, it's licensed for prescription for people with hypoactive sexual desire disorder. So that is distressingly low levels of libido. So I actually think it's slightly better than that. And I probably use it a little bit more widely, but we're not going to talk to the prescribers about that.
Yes, yes.
I
That's
actually
just a
think it
secret.
gives you, is it? Yeah. I think it gives you you know, a little bit of energy back, maybe, 10% of energy back in your day, which
Okay.
then allows you to do more things and think more widely and might put sex on the table as well because you've got a bit of pep,
You
you
need
know.
some energy for
So,
those things. Yes.
exactly, exactly.
Yeah.
And women are notoriously bad at focusing on the moment. I think men are very good at going,
Mm,
there is
very
something that
good.
I really like, I'm ready to roll. Whereas women go, well, there's a guy I really like. However, there's dirty dishes in the sink. No one's walked the dog. There's an excursion that needs paying for later in the week. I actually don't know if I've changed those sheets this week. Blah, 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 blah.
Mm,
You know?
mm,
And by all of those intrusive thoughts, it's a libido killer,
mm-hmm.
essentially. So if we've got a little bit more energy back and a bit more
Yes.
focus,
Yes.
then it's on the
Yes.
table.
Yes.
So let me tell you a little bit about it. It comes in a tube. It is a cream. It's not a gel. And it comes with an applicator. The applicator gets blocked around day 3, day 4. It's not super useful. But what you're going for is around a mil. So, like if you think of those 1 centimeter cube,
Mm-hmm.
I kind of think of it as a decent sized pea.
Mm-hmm.
Not quite as big as an edamame, maybe.
Yes. Gotcha.
Yeah. So I've just brought a little bit of cream. So the way that I do that, again, I really like to use my wrists with my HRT.
Mm-hmm.
So I'm going for a decent sized pea
Mm-hmm.
amount. And the reason I put it on my wrist is because I'm quite short-sighted and my hip is a long way away.
I like the whole not wasting anything on your hands, which I've been doing.
Yeah,
So we're
yeah,
changing that
it's
tonight.
so you're actually going for that little fat pad there, just at the top, upper outer part of your thigh. So I noticed you did that beautifully in the video. So this is where you're kind of aiming for, is this little fat pad here. And then you're just rubbing it in.
Gotcha.
Again, then you're not washing your hands and losing half your dose. So
Yes. Amazing. Amazing. So, if someone wants to get testosterone, do they have to, like, what do they say to their doctor if they're wanting
yeah,
to
so
use it?
I would probably talk about it maybe in a second appointment. Get your
Yes.
estrogen, get your testosterone nailed down.
The
See if we can
progesterone.
get them optimized,
Yeah.
and you're feeling sort of better on those. And then let's talk about testosterone as your next step.
Yeah.
And
Right.
one of the things I would talk about would be low libido, the
Mm-hmm.
fact that
Mm,
your interest is very poor.
mm.
The other thing that Susan Davies, she's one of the researchers in Melbourne, an Australian researcher. She's doing some research on testosterone at the moment. One of the things that she's found is that it actually is quite good at helping word recall,
Ah,
which is
helpful.
really interesting.
I need
Yeah,
that. I need that.
yeah.
I need the
And so
testosterone. I'm,
she's
I'm
talking
actually
about,
taking it. So,
yeah, yeah. So her theory is, and I really like it, she's like libido is a brain function, right?
true. True.
Yeah. So she's like, well, if testosterone helps with libido, which we know it does, what other brain functions does it help with?
True.
And so the first thing she's kind of found is that word finding difficulty, which I find really interesting. So, and she's,
Mm,
there's a lot more to come out of that. So,
amazing.
yeah, yeah,
Watch.
yeah. So I would maybe talk about that. Talk about libido. It can be useful for brain fog and things like that. So if we haven't, if we've got everything nailed down and it's optimized, and you're still not feeling like you're quite yourself,
Mm,
it's kind of a nice thing to aim at.
amazing.
Again, I'd probably say more useful in perimenopause than menopause, but I'm super, super happy for people to trial it and give it that decent trial.
Hmm.
If you're not getting much benefit of it, put the lid on it because down the track, absolutely will be useful.
Yeah. And if someone is, they need to be having it every day.
No, well, no. So it kind of depends. Testosterone's kind of a nice one in that you can use it like every second day if you feel like
Mm,
you're getting enough with it every
hmm.
second day.
Okay.
Um, so it's not quite as fast onset and offset as the others. So you
Okay.
can actually kind of break up your dose across the week a little bit more.
Mm,
I would say the majority of people would use it daily.
okay.
Um, But yeah, I mean, I'm probably guilty of potentially forgetting it a couple of
Mm.
times a week. But
That might be why I asked.
yeah,
Just saying.
but yeah, because it's part of my morning routine, and mornings
Mm.
are not good.
So
Um,
that being said, you should take it in the morning?
no, look,
Doesn't
there's
matter?
no necessarily benefit to morning or night. I have had a couple of people who've had disturbed sleep with taking it at night.
True.
It's not common,
No, I was going to say I haven't had
but
that problem.
yeah, maybe, for some people it could
Okay.
potentially affect their sleep. So,
Oh,
yeah.
interesting. Well, good to know that it doesn't matter though. So,
No, it doesn't matter.
yeah. The next thing, of course, that we need to talk about, every woman needs to know about the vaginal estrogen, the skincare for your vagina. Dr.
Yes.
Cate, tell us about this because people are confused, not realizing that vaginal estrogen is not actually HRT. It is skincare for your vagina, that we all need to be looking after the girl.
We absolutely do. So, vaginal estrogen can come in a couple of forms. So, it can come in a pessary form, like a tablet form that you insert,
That's what I
or it
do.
can come as a cream. Yeah. So, either way, what we're doing is we're introducing localized estrogen to the skin in that area. So the skin in that area is really prone to breakdown of collagen, breakdown of the stretch that our vaginas would normally have, and loss of moisture and prone to breakage and splittage and
Mm,
discomfort. So
ouch.
obviously not great things from the point of view of an intercourse position. Also leaves you much more prone to UTIs or urinary tract infections.
Mm,
I think we've had a chat about it before, where we sort of talked about the fact that once a bug gets into a dry vagina, there's nowhere really for it, nothing sort of washing it down and
mm-hmm.
out.
Not good.
So great opportunity for it to multiply and become a little bit problematic in the area. So the use of vaginal estrogen is really to look after just the localized skin. Also, people who have a bit of an irritable bladder, some people's bladders become a little bit overactive as they become menopausal, and reducing the risk of urinary tract infections. So, we would not consider vaginal estrogen HRT. It is not systemic. It doesn't treat hot flushes. It doesn't treat any of your systemic symptoms. It really just manages those local symptoms. So whether you're using a pessary or a cream doesn't matter, but night time's a really good time to apply this because then gravity's your friend. You're lying down, it's going to stay in that area for the longest period possible and treat it. So the way that you would use this cream, because it is so weak, we need to give it a loading dose. So we need to actually use it for 7 days in a row at the start
Mm-hmm.
to load up. And then you can use it 2 to 3 times a week ongoing. That's
Mm-hmm.
all you need to do. So
Mm-hmm.
pick 2 nights a week, or 3 nights a week, Monday, Wednesday, Friday. It doesn't really matter. You don't need to space them out evenly necessarily. Just use 2 nights that you're going to remember and get it on.
Mm-hmm.
If you forget those 2 nights, it's so weak, you need to go back and do that loading dose again.
Oh,
So
true.
if you go
Like,
away for a week and you forget it,
oh wow.
yeah,
So,
back up to
so,
the loading dose
so
again.
if you miss a whole week, you have to do another week of loading.
Yeah,
Wow. Okay,
yeah,
that's good that we
yeah.
covered that. I will not miss.
Yeah. So it's super low dose, I
Yeah.
guess.
Yeah.
So, and I guess from the point of view of, a lot of women ask me, what if I have sex when I've got it here? It's
Mm,
totally fine. It's
mm,
localized. It's not going to
mm,
harm your partner.
mm,
I would say get up and have a
mm,
wash. That's all.
mm. No,
Um, you know,
there's stuff going on up
everybody's
there
saying
anyway,
try
so
to
I think we're
plan these
fine.
things, so you tend not to. But on your loading week, you might sort of get a bit of a vibe. Who knows?
Yeah.
But yeah. So what I would say, I just got this very cute little model that I spent a lot of money on.
Oh
Um,
wow.
Yeah, yeah. So what I would say is we're going for the bottom third of your vagina. So just really at this introitus here is where I want you to pop the cream and give your clitoris a little swipe on the way past.
Give
I'm just
her a
going to show you if you
give
say
her a
that you're
bit of love on the way because she needs it.
giving her a bit of love. Okay. So if you're popping it at that introitus, here you are, you're getting your vagina. You're also giving your urethra, so that's where the wee comes out of, a little bit of a swipe because
Mm-hmm.
it can sort of have hormonal changes as well. If you don't give your clitoris a little bit of localized estrogen, it can sometimes retract, which is not great.
Gosh.
And weirdly, you can actually start to lose your inner labia without localized estrogen. I know.
Far out.
It's like
If
puberty.
that is not motivation to get some vaginal estrogen, I don't know what it is. I'll tell you what, I had a friend reach out to me and she said, "Oh, I'm doing HRT, but I don't need the vaginal estrogen because I am single." And I'm like, "Ah, no, 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 you've missed the point. We
Yeah.
all need the vaginal estrogen." I noticed very quickly how different, like, because the dryness, because dry as a desert, the dryness just gradually happens, right, over time, and you don't realize it's happening. And then all of a sudden, you're like dry, like the Sahara Desert. And
Mm-hmm.
it was so quick, the change, once I started using the vaginal estrogen.
Mm.
And
Yeah,
so,
it's amazing.
mm,
Mm.
but I didn't understand. So I started using it, not understanding. Now it's my skin cream. I would never go without it.
Yeah, correct.
Yeah.
And what we've got to know, like reducing UTIs. I mean, of
Oh,
all of the things, ovestin probably saves more lives than anything because
mm,
old ladies get UTIs and they die.
it's terrible.
They become delirious. They lose cognitive function. So really super important to keep on top of this stuff.
Yeah, for sure. Because 100%. Okay, so quickly, I know your time is very valuable. So quickly, what, or if there's any side effects, like starting HRT, what does that look like, if at all?
Yeah. Yeah, sure. So yes, you never really get away with outside effects for most things. And what I would say is starting systemic HRT, which is your Prometrium, your gels,
Mm-hmm,
not your localized cream.
mm-hmm,
The most common side effect is sore tender breasts.
mm-hmm,
So you can get quite swollen, a little bit puffy. That real premenstrual breast sensation where they're a
mm-hmm,
bit icky.
mm-hmm.
That can actually last for a couple of weeks. But if you
Right.
ride it through, it'll just go away. It's like your
Okay.
body just gets super excited that there's hormones around and hangs on to them and,
Yes.
gets a bit excited. But that will settle.
Mm-hmm.
So just give it some time. So
How,
give it that
how
week.
long? How long would be,
Yeah, a couple of weeks. I would say,
okay.
I would say 99% of the time it's settled within 2 weeks.
Okay.
Yeah.
Yeah.
Can be quite tender though, so it's
Mm-hmm,
just a matter of psychologically riding through that, I think.
mm-hmm.
Um, the other thing that can happen is a little bit of acne. You get a little bit of skin
Oh,
moisture back, which is
true.
exciting. So,
Oh,
you might get a pimple or two, but,
oh,
that's
true.
okay. Which is fine. I guess the main side effect is that you feel a whole lot better. Start
Yes,
to feel like
yes,
yourself.
yes. Yeah, it was
So,
mainly like the breast tenderness because I definitely have experienced some
mm,
of that. If someone
yeah.
was to get that and it didn't, so like what time frame if they still, like, say it's 4 weeks and, or I don't know, what time frame would they be like it's too long to still have sore boobs?
Yeah, I would say 4 weeks is too long.
Yeah, okay. So go back
Yeah,
to your
I would
doctor.
get in touch with your prescriber.
Yeah,
If
okay.
it's 4 weeks down the track and your boobs are like, oh, I can't even touch them, I can't lie on my front, that kind of
Yes.
stuff.
Yeah.
Yeah. Um, don't forget, um, the only other thing I was going to say was, sorry, I meant to say the other side effect that you can get is it can cause a bit of bleeding. So a bit of
Ah,
bleeding inside.
yes,
Yeah.
yes. Okay.
And more likely to cause it if your last period was 9 months ago,
Mm.
probably probably will get some bleeding or spotting. If your last period was 5 years ago or 6 years ago,
Probably not.
unlikely to
Yeah.
cause
Okay.
bleeding. Yeah.
Yeah.
But it's again, it's that same thing. Your ovaries just get a bit excited. There's some
Yeah.
hormones, and it goes, "Oh my god, I know what to do."
Yeah.
But then there's enough to keep it up. So
And I
makes
think
sense.
it's good to talk about that, like, because I had a client once who was, she read the side effect in the packet, the side effects,
Oh,
and the side
yeah.
effects are crazy, like crazy. If you read the
No,
thing, like, don't read the thing, like,
ridiculous,
it's
aren't they?
ridiculous. That's why I'm like, we need to talk about this because those are like, that's ridiculous. Like, but like, that makes sense, right? We're giving our body back some hormones, and the bits that used to, like, the breasts and, like you said, the spotting, obviously that's your body going, oh, we've got some back,
Yeah.
so it makes
Yeah.
sense for that to be a side effect per se. So I think these are the conversations that people really need to understand and have. So if they do decide to, and like I said, I did get a bit of sore boobs, and actually I felt like my boobs got bigger. I don't know if they did or not. It just felt like that, but that's a bit of a side effect. If that's, I'm happy to have that one. Like, yeah, exactly. But like talking about that is like a good kind of outcome as well. So yeah,
Yeah,
but
definitely.
as people are listening to this, if they have any other questions that we've tried to kind of talk about all of the things. So if there's something that we've missed, or you're confused about, then please just drop it in the comments and we can definitely like sort that out for you. Or hopefully it gives you more information to take to your GP if you need some help. Dr. Cate actually does do telehealth appointments, so we'll put all your details, like with all of the information as we push it out, so you've got her contact if you need it. Thank you so much for running us through that today, Dr. Cate.
That's great. And yeah, maybe if people sort of have suggestions about what they'd like to us to talk about next.
Yes, exactly. So you can drop that in the comments and we will come back and fill you in on anything we can to help you on your way to health and wellness. And hopefully, just actually, you know what we need to talk about, Kate? We just need to actually talk more about sex life, because I was talking to my program today, and one of the modules in my program, we talk about intimacy, because no one talks about it. So that could actually be a good topic, just how your intimacy or love life can be affected at this stage of life, but also just the difference between like men and women. And like obviously Dr. Kelly Casperson has done like some great work in this area, but this could be a good conversation to have, just to be able to normalize the conversation a bit more, so people are not wondering, like, because when we don't talk about it, we're all going, well, what's normal, what's not, because we don't talk about it. So maybe that could be on our agenda in the future as well.
Absolutely. Sounds good.
Cool. Well, thanks for joining today. I appreciate your time, and I hope
No
everyone
worries.
has really enjoyed this conversation. Stay tuned for more. We'll be back. That was great.